So today we are going to talk about intrauterine devices. There are three types of intrauterine devices. First generation is non-medicated, for example lipase loop. Second generation are medicated, for example copper T200 and copper 7. Copper is believed to have strong anti-fertility action. It has a strong anti-fertility action. The third generation are medicated or hormonal IUDs, for example progesterone and LNG. Progesterone, the amount of progesterone present in the IUD is 38 milligrams, and per day 0.5 micrograms is released. So we'll talk about advantages of copper T. Copper T is believed to have low expulsion rate and side effects. It is best tolerated in nulliparous women and easily inserted in nulliparous women. It is an effective contraceptive and effective if inserted into the vagina 3 to 5 days after unprotected sex. Now we'll see about contradictions. Contradictions are of two types, absolute and relative. In absolute contradiction, IUDs are contradicted in suspected pregnancy, in previous history of ectopic pregnancy, pelvic inflammatory diseases, cervical cancer, and unexplained vaginal bleeding. The relative contradictions of IUD are anemia, purulent discharge, and menorrhagia. Menorrhagia is nothing but increased blood flow during menstruation. Now we'll talk about complications of IUD. The first complication is bleeding. Bleeding usually is more in the initial months after insertion of IUD and subsides after 1 to 2 months. So the second complication is pain. There is increased pain during insertion of IUD few days after insertion of IUD and during menstruation. It is seen in the initial 3 months. It is also one of the main cause for removing of IUD. Because of pain, the women prefer to remove IUD. The third one is pelvic inflammatory diseases. And fourth one is uterine perforation. It is most commonly seen in postpartum insertion of IUD. If the IUD is inserted 48 hours to 6 weeks postpartum, the IUD will migrate into the peritoneal cavity and it will lead to complications such as intestinal obstruction. The fifth one is expulsion. Expulsion of IUD is seen most common in young women, nulliparous women, and women who have had IUD insertion in the postpartum, that is 48 hours to 6 weeks. Now, expulsion may occur during menstruation or initial days of